Now, the national nurses' strike continues to wreak havoc across the country, leaving hundreds of patients in public hospitals stranded without crucial medical care. The nurses' union is accusing some county governments of blatant discrimination and lack of goodwill in addressing the demands. However, in a rare breakthrough, Machakos County has struck a deal with its nurses, bringing to an end a week-long stalemate that had paralyzed services. Elizabeth Atino, our health reporter, tells us more.
Deserted hospital corridors, empty hospital beds, and patients in distress is the scene witnessed in different public health facilities following a nurses' strike that has today entered its 13th day. The Kenya National Union of Nurses, through its Secretary General Seth Panyako, has refuted political interference and tribalism claims made by the Trans Nzoia County government.
They are not based on any fact, they are null and void, because the union in Trans Nzoia has almost all the communities living in Trans Nzoia. For example, our chairperson is Cyprian Nyakundi, who is a Kisii.
Nurses from Trans Nzoia, Nairobi, Bomet, Busia, Isiolo, Lamu are still on strike, while those from Kwale, Elgeyo Marakwet, Siaya, Kitui, Kisumu, Migori, Kilifi, Uasin Gishu, and Machakos have called off their strike.
The strike that had affected the provision of medical services within our facilities is now suspended. We expect provision of services in our facilities to resume at normalcy immediately.
Our government has agreed, number one, to clear our loans by 30th of September. The government has agreed to implement our nursing services allowance and at 10,000 per month with the arrears backdated. They've agreed to pay our uniform service allowance, which has increased to 25,000 from 10,000.
Some of the grievances tabled by the nurses include poor working conditions for the nurses within the public health system, failure by the county governments to implement the salary structure proposed by the Salaries and Remuneration Commission (SRC) on the 12th of September 2024, as well as lack of implementation of the return to work formula agreed upon on the 2nd of November 2017.
Strike notice cited failure by various employers to honor their obligations and duties as established by law, despite repeated engagements and attempts to resolve those grievances.
Additionally, the nurses' union has accused counties of failing to negotiate and finalize the collective bargaining agreements, as well as failure by various government entities to remit third-party deductions, a move they say amounts to financial misconduct. On a positive note, the nurses' union says there has been commendable progress in the negotiations with some county governments. Elizabeth Atino, TV 47.